move it a bit, your face is a bit close to a screen.
Hi, everyone. Good afternoon, everyone. If someone can type in the message section that you can hear my voice before we start the session today. Yeah. Okay. So good afternoon, everyone. I'm Jessin Joy, Program Coordinator, OBA Program at Leeds College, Australia. I welcome you all to this session today about how to handle priority questions in your NCLEX examination. So I'm sure that most of you are in your journey to become registered nurses in Australia. And most of you have taken the first step, that is your application procedure with APRA already. Some of you are waiting for your outcome of your assessment, that is waiting for your NCLEX examination. Some of you have already got the assessment and already started the procedure. Some of you have already, been doing the programs and already preparing yourself for the NCLEX examination. So we thought it would be very good for you to know how to handle the prioritization or the priority questions in your NCLEX examination. If you have friends who have had recent experiences with the NCLEX examination, you will come to know that a lot of questions are being asked on management of care and questions on prioritization and delegation, because this is an important skill that you must know to practice in an Australian healthcare setting or in any kind of healthcare setting as a registered nurse. So today we will be discussing how to handle these questions. We'll see how to, what are the basic principles and guidelines in terms of handling these questions. And also we'll be practicing some of these questions as well. So let's begin today's session with, understanding what is prioritization. So, okay, let me just open up the presentation. Okay, I hope you all can see my screen. So as I said, welcome to you all to this session about prioritization. So now what are the objectives of this session? So in today's session, we will be looking at, trying to understand what is the importance of prioritization in nursing care. Then we will also be looking at the questions and see what kind of options we have and how to prioritize based on critical thinking and how to take sound decisions based on rationales. And of course, we'll be practicing some of the NCLEX style priority questions. So as I said, NCLEX contains many types of prioritization questions wherein you can be asked that, there are multiple patients in the options, and you can be asked that as a registered nurse, who would be the patient that you will be attending first. And apart from that, you also have priority questions where, you have one single patient and some options are there related to that only one patient. And from these options, you have to select what is the priority nursing action that you will do based upon the case scenario. So there are various types of priority questions that you will see, but commonly what you will see is that in terms of, which patient that you will assess first or which patient that you will attend first. So basically the questions wherein multiple patients with their conditions are mentioned, and you have to take a sound judgment based upon your critical thinking and clinical decision making and see that who will be the first person or first patient that you will attend to. Okay, so I'm sure I'm just going to revise some of the concept that you can see on the screen. This is nothing new for the nurses, across the world. So how do you classify a priority? So if you classify priority, just, you have to think of it in a way that high priority, which is basically the conditions or patients that need to be addressed now, immediately, without losing any time. And if you don't treat them immediately, it can cause serious harm to your patient. Okay, so these patients will be highest priority or high priority patients. Some of the examples that you can think of, a person who has come to your emergency department with acute chest pain, which has been radiating to the left arm, and he's demonstrating symptoms of a infarction or angina. So, of course, that patient is of highest priority. Or you have had a patient who's had a trauma or a severe accident and is bleeding profusely. So such patients are your highest priority patients who need to be dealt immediately without delaying any kind of care. Now, coming to the medium priority ones. Now, medium priority ones are non-life threatening. However, it doesn't mean that you can ignore them. You certainly cannot ignore them, and you should be attending them within the next 30 minutes to 1 hour. Okay. So some of the examples that I've put in, like, for example, some migraine patients, some sprained ankle, earache patients, and patients who can wait, but of course they need to be attended within the 30 minutes and around, and because they can be impending complications or impending issues with them as well. Now, the lowest priority patients are those which are less urgent conditions who can wait, and some of the example are mild rashes, some mild pains and aches. So all these patients are low priority patients. Okay, so the first thing that you should remember when handling your priority questions are, which category are these conditions that are listed on my question paper, on my options. Okay, whether they are high priority, whether they are medium priority, or whether they are low priority. Okay, then you all must have seen and learned about Maslow's hierarchy of needs in your undergraduate program, also in your master's program. So Maslow has made it very simple for us to know what is it more important in terms of living. So as a nurse, any kind of physiological needs that your patient has in terms of his, survival, those are the most important needs that you should be taking care of. Okay, always remember, physiological over psychological. So physiological needs, you all know, your food, water, shelter, and any kind of needs that your patients have in terms of physiological takes priority. Okay, then comes your safety needs, love and belonging needs, esteem, and self-actualization needs. Okay, so think of Maslow's hierarchy of needs. Remember, physiological over psychological needs. Okay, so and when I was doing my research about this topic, or I was preparing myself, I found this very interesting cartoon, and depiction basically, which shows some of the very important concepts of prioritization and delegation as well. So as I said, I already mentioned, always physiological, profuse bleeding, all these are patients that you should be treating immediately. If you have other patients on your hand who is having some psychological trauma or psychological issue, they can wait for a while, but treat the physiological needs first. Then acute conditions over chronic conditions. So an acute condition, like as I said, example, chest pains, an acute condition, sudden onset, you should be treating those patients over, chronic patients. Okay. Then unstable, of course, unstable versus stable, you should be immediately going towards the unstable patient. And sometimes you have very unpredictable patients over predictable patients. For example, a COPD patient who has oxygen saturation of, let's say, 90-91% is a predictable outcome in a COPD patient. Whereas a normal person, if he has an oxygen saturation of 89-90%, there's something wrong there. So unpredictable situation over a predictable situation is, you must remember that. Okay. Then last but not the least, always remember systemic issues over local issues. For example, you have a patient who has a high fever. Fever indicates a systemic issue versus a patient who has a rash or, mild laceration. So these are all local issues. So remember, systemic over local issues. Okay. Then, before you take any action, always remember the first thing that you learned in your nursing school: assessment of the nursing process. So assessment before taking any kind of action. Okay. And remember, always remember your A, B, C, D, E. I need not explain this in detail. You all are much aware than always, First your airway, then your breathing, look at the circulation, look at whether the patient has any kind of issues with limb movements, limb reflexes in your disability, any kind of exposure to heat and cold that can harm the patient, and always follow A, B, C, D, E when assessing your patient. So you come to know what is the priority intervention or what is the priority action that is required here. Okay. Always remember, assessment over implementation. Okay. So I think I have given you a brief idea about, what is the concept on how to deal with prioritization. Now let's put the concept into some practice. Okay. So ready for your first question today? So the first question that you see on your screen: the nurse is assigned to the following clients. what will be the order of priority in assessing these clients? So the first client is a patient who is going to have a surgery for hysterectomy the next day. Second question, second patient, a client with heart failure who has a 4 pounds weight gain since yesterday and is experiencing shortness of breath. Third, a client admitted to the hospital for observation who has absent bowel sounds. Okay. And the last one is a 24-hour post-operative client who has a wedge resection of the lung and has a closed chest tube drainage system. Okay. So you have to look at the options and see what is the order of priority which I will be attending this patient. Okay. So start typing your answers in the comment section and tell us, what do you think? Who should be assessed first? Who should be assessed next? Okay. So remember what we discussed, A, B, C, D, E. Now look at the client number 2. Clearly written, a heart failure patient is showing evidence of weight gain and is experiencing shortness of breath, breathing problem. Okay. So then number 1 priority, client number 2. Okay. Client number 2 should be your first priority if you compare with others. Okay. Now look at the option number 4. Although it is not indicated in the question that the person is having any kind of symptom in terms of their breathlessness or anything. But if you compare this patient with other patients, this person has some systemic issues. Okay. He has some issues with his respiratory system. So after going to client number 2, your second person should be whom you should be attending is client number 4. Okay. And then client number 3 who has some absent bowel sounds, and the client number 1 can wait because his surgery is scheduled for the next day. So after clearing up these patients, then you can go to the client number 1, explain him about the surgery, do your preparation for the surgical preparation as per your hospital protocol, and move ahead. Okay. So do you understand how to handle your questions? Remember your A, B, C, D, E. Remember systemic issues always above the local issues. Okay. Let's move ahead to the next question. Okay. So here, the nurse is the first responder at the scene of a school bus accident. Which victim will the nurse try to treat first from the following? Okay. So the first child, a confused child with bright red pulsating wound from a leg. Okay. The second client, the client with multiple compound fractures of the arms and the legs. Okay. Then third client, a client or a child with simple fracture of the arm complaining of arm pain. And third, but not the least, irritated and crying child who's sobbing because of minor lacerations on the face, arms, and legs. Okay. So who should be nurse looking the first or triaging, the top priority? Okay. Can you all type in the comment section? What do you think? What is your estimate? Okay. Okay. So look in the options. Is there any patient who is having or child having any airway issues? No. Is there a patient who's having breathing issues? No. Is there a patient who's having some circulatory issues or who can have circulatory issues? Okay. Now look at the first child, a confused child with bright red pulsating from a red blood pulsating from a leg wound. It means they can be an arterial puncture. So of course, circulatory issues, the person can go under shock if the bleeding is not stopped. So your first priority patient should be client number 1 or child number 1, the confused child with bright red blood pulsating from his leg wound. Okay. Okay. Next, let's go to the third question for the day. The nurse working in an emergency department is assigned to triage clients coming to the emergency department for treatment on the morning shift. So imagine you are the nurse on the morning shift, you are responsible to triage the patient. Now, which patient you will assign priority first? Okay. So I think I have already put the answer. I'm sorry about that. So a client with history of seizures and is complaining of muscle aches and headaches. A client who twisted his ankle when skating and is requesting pain medications. A client with minor laceration on the index finger while cutting vegetables. He had this. And a client with chest pain who states that he just ate some very, very spicy curry. Okay. So I think I have mistakenly put the answer here itself, but you can look at the option and see. Always remember chest pain, impending condition that can, that can be life-threatening, although the person is saying that it may be because of the spicy curry that I ate, maybe some gaseous issues, but remember, chest pain on top priority. So always remember, you have to treat this patient first, okay? Okay, next question. The nurse is assigned to care for 4 clients. In planning the client rounds, which client should the nurse assess first? First option, a post-operative client preparing for discharge, a client requiring daily dressing change of a recent surgical incision, a client scheduled for a chest x-ray after insertion of a nasogastric tube, or a client with asthma who requested a breathing treatment during the previous shift. Okay, so look at the options. Think, what will you do? Can you see an impending danger coming? An asthmatic patient, he has already requested his treatment, his treatment for his breathing problems. He hasn't gotten yet. First priority, okay? So your answer will be client number 4, a patient with asthma who has requested a breathing treatment during the previous shift, okay? Good. Okay, so I think this must be the last question of the day, or maybe one more question. So the RN has received the assignment for the day shift. After making the initial rounds and checking all the assigned clients, which client will the RN plan to care for the first? Okay. So a client who is ambulatory, walking all good. A client scheduled for his physical therapy at 1 p.m. A client who has fever. He is diaphoretic, sweating profusely and restless. A post-operative client who has just received pain medication. Okay. So I think very simple to answer. Look at the 4 options and see there's a person who has fever, who's diaphoretic and restless. And if you compare the other 3 patients, they are stable patients, okay? So the person who is ambulatory, all good. The person who is scheduled for physical therapy, not indicate that he has any kind of symptoms, all good, stable. 4th, post-operative client has already been given pain medication, settled. So who's unsettled here? Okay, your person number 3, who has fever and has restlessness and is profusely sweating and diaphoretic, okay? So answer number 3, okay? So now, I think I've given you a basic idea about prioritization. And of course, it's hugely important because time is the most valuable thing. And unless and until you don't know how to prioritize your patients, you're losing important time. And it's a famous saying that time is money. So when you waste time, you waste money. So it's important for you to understand prioritization so that you can provide care appropriately, use your time efficiently, and also, you're able to cater to the needs of various types of patient. Okay. So I hope you enjoyed today's session on handling prioritization questions. It was very brief, but of course, when in our NCLEX RN program, we take a very detailed review of the topic. But for, quick live sessions, I think we have tried to summarize the topic very briefly for you. Okay. Before we close for the day, I'm very, very happy and excited to tell you that we are starting our first OSCE batch on 16th of November, Monday, at the heart of Sydney, Parramatta campus, our beautiful simulation center in Phillip Street, Parramatta, 5 minutes walk away from the Parramatta station. So if you are a candidate who has received the information from APRA about Adelaide Health Examination Center already opened, and the first examination day for the OSCE in Australia is 14th and 15th December. And you are thinking and wondering, oh, I have already cleared my NCLEX. How do I prepare for my OSCE? Do not think further and waste your time. Call us today. We are starting our first OSCE session. We actually preponed the session to accommodate the needs of the students who want to appear for the 14th December examination. Okay. And our training is Monday to Friday, full day intensive training, rigorous training between 8 a.m. to 2 p.m. and 2 to 5 p.m. is your self-practice under faculty. So if you're working, you don't have to worry. You can look at your afternoon shifts if possible, and do your preparation in the morning. Okay. And I have received many calls from various students saying, ma'am, is there anything online for OSCE? Students, please remember, this is the most important time in your life. This is the most important examination of your life. Think critically. Can any program with which is practical based, or an examination preparation, which is practical based, done online? No. Don't make this decision based upon, what is easy for you, what is quicker for you. Make the decision, make a sound decision for yourself. Our training is fully on campus, Monday to Friday, 4 weeks training, intensive training under Australian registered nurses who have taught in the bridging program for years and have experience in doing OSCE, conducting OSCE. They have been assessors in OSCE examinations for the bridging program. So don't hesitate to call us, discuss with us your questions, and we will be very happy to help you in terms of your OSCE preparation. Okay. And also, the next batch for NCLEX examination is starting on 7th of December. We are not having a holiday this time. We want you to pass your NCLEX examination. And maybe next year you can all have a holiday once you become registered nurses in Australia. So no holiday for us, and we will not stop in the holiday time. We will be continuously working towards making you achieve your dream to become a registered nurse. So 7th December batch is our next NCLEX RN batch. You can see the numbers on the screen and our email ID obaa@leithcollege.edu.au, and the 2 numbers that we have for Australia and India. Call us today to know everything about OSCE and NCLEX, and we will be very happy to help you with it. Okay, so I think thank you so much for joining us today. If you have missed the session, we will be definitely emailing you the link of the session. And if you have any questions about this topic, anything else, or anything randomly, you can always call us and inquire about us. As well as, I would like to tell you all that we are having free one-on-one consultation in our campuses in Parramatta and Haymarket. For your self-check and portfolio. So learn from the experts how to do your self-check and portfolio appropriately. You can drop in the campus anytime with the prior appointment, or else we can also do a Zoom session with you to make you understand how to do your self-check, how to submit your portfolio correctly. Okay, so thank you all of you for joining today's session. I hope you enjoyed the session. I hope you learned a little bit at least about prioritization. Thank you. Catch up with you soon next week, wherein we are doing a detailed session about OSCE. So APRA has published the OSCE handbook. If you don't have time to read about the OSCE handbook, don't worry. We will summarize it in a simple language, something simple to understand, and see you next week with that live session. Thank you so much. Thank you, all of you. Enjoy your evening.